everything from, system performance measures to the pit. I conducted it, actually trained all the volunteers, went out in the woods and collected the data and then would report it back. So I've kind of got a pretty good feel, I think, for a lot of what is involved with HMIS. And so eventually what I started doing was creating dashboards for my COC. And I began getting requests to build dashboards for COCs across the country. So I did that, and back in, it's been actually about 2 years now, I've been doing this. And I've had the pleasure of working actually with several California COCs. Let's see, I have a list over here I was kind of looking at. So Sutter, Yuba, or Yuba, I'm probably saying it wrong, the Homeless Consortium. I've also worked, actually I'm working with San Diego right now, Richmond, Contra Costa County, Central Sierra Continuum of Care, but I'm also working with Dallas, Charlotte, North Carolina, Flint, Michigan, Detroit, Michigan, probably about 10 different COCs in Florida. So I work with a lot of organizations, and I really enjoy being able to come and present to COC boards and to see kind of what unique and amazing things everybody else is doing across the country, because everything's a little bit different. So anyway, with that kind of introduction out of the way, I want to go ahead and kind of get to the dashboards. And I'll go ahead and probably cover them quickly, and then I'll save time for questions. That way I'm not taking up a bunch of time showing you the dashboards, when you can actually do that yourself as well if you'd like. So I'm going to share my screen. Over here. All right.
And before you start, I just want to be real clear with direction to the board that you're not here to kind of represent what our data means or what that data picture is for the community. You're showing us how dashboards work and what other communities are doing with them. Questions for why the data looks the way it does or what that's saying is that's us as the CSC to decide. Up to that, so you're not here as an expert on what our homeless data is saying as far as that picture goes. I just want to make sure that's understood by the board.
Yeah, so these are just going to be demonstration dashboards. Yeah, exactly what Brian was saying. So these are demonstration only. They're not built into your website or anything like that. But that is hopefully where we can go with this. That's kind of the proposal that I'm putting out there. So one of the things I'd like to point out is that the dashboards I build use standard reports that come right out of HMIS. So there's really not a lot of custom stuff that needs to be done. It's reports that are always already built in. And the three that I use, the first one's called the APR. And the APR report, I'm going to go ahead and refresh the dashboard. So this is built actually right into Tableau Public, but don't worry about the word public. These are all protected. In fact, we do not use any kind of actual names or social security numbers. All that data is stripped out, or in the process, some CSCs will actually strip the data out first. But just so you know, there's no data that can be downloaded or accessed by people in the background whatsoever when it comes to these dashboards. So the APR dashboard, what I call the analysis dashboard, is one that can be refreshed as often as you like. A lot of times people will refresh these monthly, but they can be refreshed daily with your data. And when you have one of my dashboards, you're in control of that dashboard. So I have written software that'll take your data or take your report that comes out of HMIS and will transform it into this dashboard. So this isn't something that you need special software for. There's no additional costs involved or anything like that. Once I build a dashboard like that, it's for a 1-year period of time, and it's kind of a subscription model, and you have access to that dashboard for that full year, and you can populate it with your data as you see fit. What I try to do with these dashboards is highlight what are called key performance indicators, or KPIs, you might hear me talk about. And so we have just some basic numbers that come right from your APR. So again, these aren't any necessarily even calculations that I've done at the back end. These are coming right out of your HMIS. So these numbers are taken and then they're made extremely visible and easily digestible to your public. It can be stakeholders that are public members or clients, or really anybody could go to your website and see this data. So I'm just going to kind of scroll through here slowly. One thing I'd like to point out too is these are tablet and mobile friendly, because a lot of times dashboards that people will build are specifically for desktop environment. But I find that about anywhere from 30 to 50% of the people that access the dashboards do it for mobile devices. So as you can see, it's just basically broken down by demographics and some of the key performance indicators like I was showing. Like it will have income in there, You'll see unemployment, insured, but again, this is all coming out of your HMIS. And it's really just taking what would normally be like an 18-page kind of an ugly report with a lot of numbers, a lot of information, but not necessarily something that you just want to hand out to somebody or post on your website, because generally they're going to get through the first half page and just kind of probably check out. So this dashboard just kind of hits some of those key numbers and puts them right out there really easily for everybody to see. And I like to call this kind of a static dashboard because there's not a lot of filtering that goes on in this dashboard. I can filter veteran households and people experiencing chronic homelessness, but it's only for the kind of the basic household demographic and age. It really doesn't break out much different than that. So like I said, this is kind of a static dashboard. But it looks good, and it embeds right into the website, so you don't have to necessarily go to another site if you don't like to. You don't have to go to Tableau Public. These will embed right into the website. And I'm going to go ahead and go through the next two quickly, and then we'll come back if there are questions. So the second dashboard is one that is based off the system performance measures. And what this does is it takes an Excel report out of the HUD Exchange website, which is available to all COCs. And when you download that report, it's just an Excel file. And rather than having this Excel file that, again, maybe doesn't have a lot of contextual information, or maybe doesn't, it can be kind of clunky to some degree, this takes that and makes it easily presentable and interactive. So while you see this front page dashboard that has, again, kind of KPIs, but these are based on your six system performance measures. But these are also about 30 dashboards built into this one, because if you're curious about a number, like you see a red increase, you can click on this and it'll take you to another dashboard. Also, I'd like to point out that I have instructions built into the dashboard and also like contextual information. So I'm going to click on this KPI and it'll take me to the underlying dashboard. So again, like there are about 30 dashboards built into this one. And so if you have something like your pit day total count, it actually breaks that down into everything that's in that report. So pit day sheltered count, yearly total count, yearly sheltered count, etc. And I can just go through and I can click on these buttons up here and I can just scroll through this dashboard and I can literally just kind of click through all the system performance measures. And this dashboard is generally only updated about once a year because it typically only shows one year-over-year comparison. But again, it's broken down. It takes that Excel spreadsheet and makes it accessible through your website and all mobile devices. And people can just click through and examine your system performance measures. And then the last dashboard I like to take the most time on because it's what we call row level data. So it is much more filterable and dynamic than the other two dashboards. I think the other two dashboards are great for showing that year-to-year comparison of the system performance measures for the performance dashboard, because that's something that HUD is very specific on, and they want to have those kind of numbers out there and available. So that's a great way to do it. The APR is great, not only for COCs, but the APR can also be used for agencies. It can be used for specific projects. It's actually very flexible. And I actually have a meeting with Charlotte, North Carolina. Actually, they're having a meeting tonight. And they're going to be purchasing 13 more dashboards just for their agencies and their continuum outside of the COC or within the COC, but it's going to be a larger project because the APR dashboard, that analysis dashboard, is pretty flexible. So anyway, this is the what I call the snapshot dashboard. And I think this is the one that you're going to find probably the most interesting, because this is extremely dynamic and you have the ability to filter this thing like you wouldn't believe. So there's the hovers that I talked about, where I can hover over a KPI and I can get what you don't normally see, which is some of these numbers broken down over time. So we have number of people, households, people experiencing homelessness, but we also have things like your inflow and outflow. So what's the inflow outflow look like for your organ or for your COC? Well, we can hover and we can see that. And we can see people entering and leaving your system. We can keep going down, and we're going to break down by people experiencing chronic homelessness. And again, you can hover and there's lots more of contextual information for this. children, veterans, we break down by age, race, gender, ethnicity. Something that is kind of interesting, this is system flow by last exit. So when somebody leaves your system, it kind of captures two, or really kind of three components. The first part is, where did they come from? So what kind of category living situation? Were they homeless? Were they institutional? Were they other? What type of project did they go into? And then where did they flow? Where did they exit to after that? So this is really handy for seeing things like, where does your emergency shelter feed to? Where does your rapid rehousing feed to? Transitional housing. So this is kind of a neat flow to kind of get an idea of where people, when they leave your system, where they end up going. And then the last section here is based on data quality. I really like this. A lot of communities kind of experience a little bit of hesitation when showing data quality, but what I've found is that showing data quality on your website increases the quality of your data, because people tend to pay more attention to it and fix more problems, but it also can bring up problems or bring up concerned areas that you may not have been aware of before. And sometimes they're very simple things. Like, I'm going to tell you right now, just looking at this data, this is pretty good. When I do a lot of these demos and I look through some of the different organizations' data, it's not so great. This is actually looking really good. I like to see a lot of this stuff on here. But what I want to kind of show you now is that we can drill down into this. So we're showing a year, but I could always go back if I wanted to. Maybe I'll go back to 2018. And you're going to see the whole dashboard now filter back. We're not just going to look at a year. We're going to look at that full 3-year period. So now we're starting to see more of like changes over time. We're seeing different things that happened. One of the fascinating things I love to look at is what happened during the pandemic. But again, we can start to filter this. So maybe I want to look at people that were experiencing homelessness only. So I'm going to filter the entire dashboard to just show those people that were experiencing homelessness. And maybe I want to filter further. Maybe I only want to look at veterans that were experiencing homelessness. And this is where you start being able to drill down enough that I've actually had agencies use this for reporting. Because it's so easy to do and they don't have to run complicated reports in HMIS. They can just go to the dashboard and find what they need and click through those certain filters. Because sometimes in HMIS, the report may not be as easy or quick to run, whereas I can do this quickly and I can go through here and I can just start looking through this data. What's also pretty cool, I can go ahead and I can reset all on this dashboard, and kind of, if I don't know of any of the filters that I've put into play, I can just reset the whole thing. It'll pop me back. And then I can start looking at things by like project type or project name. So maybe, and I don't know your system very well, but maybe I want to look at this particular FSP. I can just apply that. And now I'm going to be looking at kind of these projects specifically. So this gets very handy for agencies and people that want to look at kind of target demographics or specific projects within your COC. And that's kind of the overall kind of picture of the dashboards. Just so you know, the way the process works, and this is more in the background, I'll just cover it quickly. What would happen is someone at your organization would just download the report out of HMIS. They would upload it using software that I've developed on my website, and that would put it into a database that would then feed the dashboard. And basically within 24 hours, every time you upload a report, the dashboard reflects the changes. So yeah, that's kind of it. I would love to take some questions if people have any right now.
I guess I have a question.
Sure.
So this is a service that you would contract with a COC to do.
Mm-hmm, exactly.
Okay.
Yeah, it's a pretty straightforward thing. Like I said, I'm working with about 40 organizations. So typically what I do is I will build the dashboards like I've done right here. And then if an organization wants them, they pay for them. And if they don't, they don't. I actually am running a sale right now. I normally charge $2,000 per dashboard, but there's a cost break I'm doing right now that Brian and them all are familiar with.
Like a holiday discount?
Yeah, it is. It's a Black Friday discount. You know, I do like to help people out, and just so you know, probably I would say I'm in the probably 90 to 95% rate when I do a demonstration. Most of the COCs do end up purchasing them, and I've had almost all my customers are returning, because what Brian was kind of speaking to is that a lot of times, even if an organization has the capacity to build something like this, they don't always have the capacity to maintain it. So even though they might have a fantastic person that builds an amazing dashboard, 6 months later, if that person leaves, then the COC finds themselves kind of in the lurch with that. I kind of provide a service that people can count on. It's also very cost effective, because these dashboards took me hundreds and hundreds of hours, but when I template them out for an organization, I can do that for a very low price, because I don't do a lot of custom work. It's when people ask for custom stuff in a dashboard, the price goes up. But honestly, for most COCs, the price seems to be a very good sweet spot, and I've had a very good luck just talking to a lot of people and getting the dashboards out there.
So I guess my thought is I like pretty data, and this is pretty, and it's the kind of thing our community often asks us for. But I'm not as confident that we are all entering data into HMIS, my own programs included, at the like pace and fidelity that we should. So I'm just curious, Gaither, in other communities, when they haven't had a lot of confidence in their data going in, is there anything that you can recommend when you're displaying publicly data that you're not totally sure is 100% accurate?
Absolutely. And I did this in my own COC, because what people want to avoid is what we call data shaming. And we don't want to data shame anybody. So what I recommend is, if you do have concerns in your community about that, is provide a ramp up period. So maybe these dashboards are only applied internally, or allowed to be seen for maybe 60 days or 90 days within the organization and just within the agencies, and then they're rolled out publicly. You don't have to do that. A lot of COCs just go ahead and roll them out. But I will say that out of all the concerns I've had, the two biggest ones are going to be privacy, which I delete all PII data, and I protect it with my absolute life, because I will never have client data laying out there. And then the second concern is data shaming. People are worried that their data is not going to be, kind of up to snuff, and they might end up getting punished from it. I haven't seen that happen yet, really. So far, all the communities I've talked to, data quality has improved, and they're just kind of, they're more kind of prescient of what's going on. They have this idea now, like before, it's like almost like the data kind of catches them unexpected. Now they can look at that ahead of time and not be surprised when these dashboards are up and ready.
Thank you.
Mm-hmm.
I can speak to that a little too. So that the HMIS lead would be responsible for generating the reports that get uploaded to populate the websites. And if there's a very specific reason we need to exclude like a single project, we don't have to generate every single project on these dashboards. There's some HMIS projects, like there's SAMHSA Finding Home, that we didn't generate on the dashboard. So we can exclude data. I don't recommend it generally, but if there's a really specific reason that it's not appropriate to put a certain project that's an HMIS on a public facing dashboard, it can be restricted and not bundled up with the exports that we're sending to populate the dashboards.
So, I mean, to that end, and I see, Kate, I see your hand is up, and unfortunately I have to leave in 2 minutes. So I'm just kind of getting my stuff out before I have to leave. But this is maybe a question for the board. If we were to go to do something like this, would we feel like it would be appropriate, and I'm just saying this without even thinking it through, to allow the project itself to decide whether they want to be on the dashboard or not? Or is that something that we wouldn't want to give people the opportunity to do?
I think that's bigger than just a yes or no question.
Right, I know. It's not.
I don't think exclusion of data is a good way to approach any program unless it's absolutely necessary, because accountability has to be in the quality of your data, because that's what we fund on. Kate, you're muted, Kate. Still.
Just like to jump in. I think this is fascinating. And I saw some of these being done about 12, 15 years ago, and the sophistication and the simplicity at the same time are just really remarkable. I don't know if you're aware, but we have something in this community called Healthy Mendocino that has a very expansive database that's for all kinds of services and programs. And So I was looking at this and thinking about how that has been composed and developed over the last 8 years, and how we would ever, intersect any of this, because it was designed to include all data around the community in one location. This splits it out, I think, more easily for me to read than that one. Also, I think as a individual leader or director, how I would see using this in other ways than just housing applications or housing tracking. I think it challenges it's good data to challenge the overall community, think about how are they responding to the homeless problem. And yeah, so I new on the board, but I could see this being really meaningful. However, my agency is small and isn't going to be the major part of the compilation. So, but looks good. I want to play with it, but it isn't really for me to play with yet, is it?
Oh, it is. Everyone has a link in the agenda, and these dashboards are demonstration, but these dashboards are created with actual data from our HMIS. So anyone with the agenda can click into this dashboard and filter.
Great. Okay.
Yeah, and honestly, I encourage people just to get in there and just dig around, and you provide any feedback you have. I love feedback. And I did just update this dashboard because we do have the new 2022 data standards. So you'll see here in race and ethnicity and gender, I have now taken in the 2022 standards. So they're all up to date, but this is kind of a brand new dashboard. So any feedback's definitely appreciated on it. And then I think, do we have a hand up?
Yeah. Hi.
Hi.
So this is great. I'm a big fan of anything like this being public. Yes, please. When you said that it's 2,000, is that a one-time fee, a monthly fee, an annual fee? Help me out here.
So great question. So what I normally do, I'm gonna tell you my normal pricing model, because the way I have it for you guys is it's a discounted one. But normally I do 2,000 per dashboard per year. So let's say hypothetically you wanted just this dashboard. That's $2,000. You get it for 1 year. You can update it as much as you want. If I need to make updates to it, that's all included in there. And then so what I've started doing, because I know COCs kind of budget ahead of time, and I sometimes I'll make big changes in the dashboard, like I'll add sections, or I'll make it prettier or whatever it might be. And so at the end of that year, what I've started doing to help COCs out is they have a choice of either keeping their exact dashboard for another year for that exact price, or they can upgrade to the brand newest version that's all awesome and shiny and everything, for if I've increased the price that next year. I don't every year, I don't increase all the time. But let's say next year it's $3,000, you'd have a choice. You can upgrade to the new dashboard for $3,000, or keep what you have for the $2,000, and it just becomes a yearly thing. But what I wanted to do was not increase the price every year on COCs, and to give them that kind of option to only upgrade if they choose to. But other than that, if you just stay with the dashboard you have, it'd be that $2,000 every year. But what I tend to do is I offer a discounted rate when people buy all three. So it'd normally be about $6,000. I dropped that down to like $4,499. But with the current special I'm doing right now, I think it's more like just over $4,000 for all three dashboards. And that would be for that year. And then the next year you could have a choice to keep them or whatever. So far, I've had really good success. People just tend to roll them over, and I've been very pleased and happy with that.
So I have another question for Brian probably, but in terms of next steps, what do you guys need on the HMIS committee? What would be helpful from us as a board to be able to get something like this in place?
Sure. For me, there's two components. One, it's bringing it to the board, because the HMIS League put this out there, but if we don't have buy-in from the community, feedback from the community, instead of a willingness to use this data, it's, we don't want to put it out there and have it not really be a useful resource. So it's really getting that feedback from the board, other community partners, if they want to see this sort of thing or not. And second, long-term is funding. So, I mean, the county itself is funding the HMIS software. So this would be like $4 to $6 grand a year. And we'd have to look, maybe we can pull it out of something because there's so much like ESG funding right now, but long-term, it would be working at the board to determine how we're going to fund this long-term, if we're going to keep this sort of community dashboard going after the first year. That's some off the top of my head, and Veronica might want to speak more to that as the COC kind of lead applicant, lead person.
Well, and just so you know, real quick, sorry not to interrupt, but we do have people, I have had organizations that will, since there's so much CV money, they'll buy ahead of time. So like, for example, Chattanooga, I can't remember off the top of my head. I know I have several that have paid for 3 to 5 years ahead of time because they know they have the funding up front that they may not have later.
That's one approach that we can use. So we could do like maybe 3 years using the ESG CV funding. And then we can explore possibly the state HAP funds that the COC and county both have. So there's a variety of funds that we could use to support this if this is something that the board wanted to do and would be utilized on a regular basis.
And to be clear, on the back end for the tech, the HMIS lead already has it worked out, so it doesn't really require any commitment from someone to make it happen other than funding it and using it in a meaningful way. All the back end stuff, we've already got it worked out and running.
Kate, did you have another question or?
No, more of just an encouragement of us keeping this on a, I mean, I just agree with Megan around how much the public kind of constantly asks for this kind of information, and having it be like, you know, something that's just standard and is not like, oh, let Sage send you that information, or let you know, Tony from Manzanita send you that information. So it's not coming from me or one of the individual providers who anyway, it just looks so much more professional and official. And so I just encourage us to be able to like really see it as a priority to move forward with.
Thanks, Sage.
My comment is that I would challenge us all to try and use this community snapshot that Gaither has offered us to play with for a month and figure out, are we going to use it? Okay, because you know, like I say, there's Healthy Mendocino that has an incredible amount on it, and I'm not sure it's used much by even the partners that support it. So this is a tool that's a kind of a simple, magnificent thing, and are we going to use it? So we should try using it.
Thanks, Kate. Is there any other questions for Gaither?
Well,
Thanks
thank
for
you, everyone. Yes, and thank you for having me. I really appreciate it. You know, and great questions. It's always an honor to be able to talk with other people that are trying to prevent homelessness and help people across the country. So thank you for your time. I really do appreciate it.
Okay, we're going to move on to the approval of minutes from October 18th board meeting. Veronica?
I think we need a motion.
Oh, yeah, I guess we do need a motion. Don't mind me. It's fine.
I would move to approve the 10/18 minutes.
Is there a second for the motion?
I second it.
Okay. Is there any discussion or any corrections that need to be made? No. Okay, Veronica, roll call.
All right. When I call your name, please say yes, no, or abstain. Lisa Judd.
Yes.
Oops. Okay. Jacqueline Williams.
Yes.
Kate Gadsden.
Yes.
Grace Peeler.
She's gone at the moment.
Okay. Libby.
Yes.
Thank you. Paul Davis.
Yes.
Xenia Levacho.
Yes.
Karen Lovato.
I'm going to abstain as I wasn't present.
Thank you. Blythe Post,
Yes.
Judy Albert,
I think I missed that meeting.
abstain.
Abstain.
Sage Wolf,
Yes.
thank you. Dan McIntyre
Yes.
and Noble Wadeley.
Yes.
Motion passed.
Thank you. We're gonna go on to the special meeting we had last Wednesday, or the 10th. I think it was last Wednesday.
Mhm.
So we need a motion to approve those minutes for that micro short meeting.
Would so move.
A
to
second.
approve Meetings, minutes.
I'll
Sage, did
second
you
it.
move?
I'll second
Okay,
it.
thanks, Kate.
Thanks.
Is there any discussion or corrections on those? Not hearing any. We're gonna roll call, Veronica.
All right. Lisa Judd,
Yes.
Jacqueline Williams,
Yes.
Kate Gaston,
Yes.
Libby Guthrie,
I don't know what meeting you're referring to.
Last week, we had a special COC board meeting to approve the COC
Oh,
program
Grace.
rating.
okay.
Grace
Do you
was,
want to abstain?
Yeah.
Abstain. Paul Davis,
Abstain.
Zenia Levacho, I didn't hear you, Zenia. I saw you. Thank you. Karen Lovato,
Abstain because I was not present for that one as either.
Blythe Post,
Yes.
Judy Albert,
Yes.
Sage Wolf,
Yes.
Dan McIntyre,
yes.
Noble Wadeley.
That's the stain.
Motion passed.
Thank you, Veronica.
Welcome.
We're gonna go on to updates and reports from jurisdictions. Karen or Megan?
Megan had to leave, but I'll go ahead and let Karen go first.
I don't really have much. Obviously, the Health and Human Services Agency as an agency is in its dissolution process, and so I don't have many updates from the other agencies at this time.
Thank you, Karen. Veronica?
Yes. So Megan provided me some information she wanted me to share. So I'm just going to read this. The County of Mendocino will not be applying for another Project Home Key site in any city jurisdiction for the funding round that is due January 31st, 2022. As far as we are aware here at the county, no city jurisdictions are planning to apply. Let me go back to her thing. I forgot to copy one in. There is a very, very tentative new Project Home Key site on the radar, possibly the in Philo in Anderson Valley. Philo Inn in Anderson Valley, maybe Paul knows a little bit more about that site. But there are a bunch of structural hurdles with that site, and it's not clear if it will be viable or not. And then for Project Room Key, we're not accepting up any new participants. We are focused on moving the current households, current participants into permanent housing. Each household will be on a month-to-month schedule during which they will need to provide information on their own efforts to secure housing in order to maintain their stay. They're also assigned a case manager through either McHaven or Mendocino Coast Hospitality Center, who's working with them at whatever level the client wants to engage with them at. And that's what I have for Megan.
Thank you, Veronica. Any questions from the board?
Veronica, I was just wondering, so the project home key would be like the Best Western transformation?
Correct.
And so no other city, there would have been this similar kind of money available for cities to do that?
So during the first round of Project Home Key, only counties were eligible to apply. There may have been a few large cities that were eligible, but I'm not sure of that detail. For the second round, they have opened it up to county and city jurisdictions. And so the county of Mendocino doesn't want to start a project in a city jurisdiction when that city really has they don't want to impose on their jurisdiction. We really don't. And so we want to allow those cities, if they want to have a project home key site, they would submit the application. The county is totally willing to support in any way possible, whatever is needed. But there's a lot of work, and we really want the cities to feel like they, responsible for these projects.
So really, maybe I misunderstood. So you don't know, there might be cities who are applying.
As far as we know, the 3 eligible cities of Ukiah, Willits, and Fort Bragg don't have plans to apply, as far as we are aware.
Thank you, Veronica. Shannon?
Yeah, thank you. Sorry, I have to wear a mask. I want to be clear from the city of Ukiah's perspective, we're very supportive, excuse me, of Project Home Key. We think it's been a great success, and we're grateful that the county has done this. We're not opposed to another project in our jurisdiction, depending on the location, of course, but we're not developers. Just like the county is not a developer, we don't have the capacity to manage the purchase and construction or reconstruction or remodel of a project. We don't have that kind of staff on board. So this isn't a typical operation for the city, and I imagine the other jurisdictions are in a similar position. So again, it's not for lack of support for the project. It's just that we simply don't have the resources to buy and remodel a giant building.
Thanks, Shannon. Sarah, did you have a question?
I just wanted to say also from the city of Fort Bragg that we are working right now with Danco on the permanently supportive housing units. That's going to be the 20 units at the plateau. And we're just eagerly awaiting for that to be a success so that the community out here would be interested and supportive of more housing like this. So it's a little bit of what Shannon said, not being developers, and also that we're awaiting for our first project to open up and have successful.
Thank you, Sarah. Do you have anything else, Veronica? Nothing?
No, that's
okay.
it.
We're going to go on to the next update from the city of Ukiah. Noble or Shannon?
I didn't prepare anything. I'll just say that I think our patrol officers are having to deal with some more homeless people. I contribute some of that to the weather, and people have kind of moved more into the city, from outlying areas or wherever they were at. So we're dealing with more people in doorways and things like that, but nothing, I don't have anything more than that.
Thanks, Noble. Shannon, did you have anything else?
No, I don't. Thank you.
Okay. So any questions for Noble or Shannon? I not see anything. We'll go on to the city of Fort Bragg. Sarah, do you have an update?
A short update. I want to say hello to everybody. I've switched positions a couple of times since last time I've been here. We don't quite have a representative from the city that's attending these COC meetings regularly, but I wanted just to let you know that I am tracking the agendas when they come through. And I'll try to show up at the next meeting with some more details on our emergency weather shelter. I know that the details of that are being finalized right now. And, just to mention the Danco project's going smoothly. It's a little wet out here, but they're still getting they're still building, and they're looking at the permanently supportive housing units to be open late April. And so that's kind of my very quick update. If there's ever anything you guys are curious about, Veronica, or you can email me and I can include that in the report, because I know that we're geographically kind of isolated, and when we don't come to these meetings on the regular, you guys probably have no idea and what we're up to over here. So thank you.
Thanks, Sarah. Was there any questions for Sarah? I'm not seeing any. We're going to move on to City of Point Arena. Paul?
Yeah, sorry, I was getting myself set here. The only thing we have to report down here is we are still trying to implement some sort of safe parking program here at City Hall, but we need assistance with somebody to manage the parking program. We don't have the staffing to do that. So we've been looking around. If anybody here has any thoughts, please let me know. We're excited to try and do something different as long as it's done properly. Thanks.
Thank you, Paul. Any questions for Paul? Not seeing any questions. Or any other jurisdictions that have an update that I missed? Okay, if not, we're going to move on to standing committee reports, strategic planning. Veronica probably has more on this, but I'm setting a meeting with Mari to talk about the strategic plan. And I don't know if you have anything else more, Veronica, but we haven't had another meeting since the last one that I missed.
I provided Mari a list of the COC board and member contact information, as well as several agencies that provide homeless services. And she's going to be reaching out to conduct interviews with everyone to get an idea of what you've been able to accomplish in terms of the strategic plan in the last year, trying to, just gather that information and those updates. So please expect a contact from Mari soon.
Okay, thank you, Veronica. Angelica, is Angelica here? I don't see her on my screen.
No.
No.
Was
So
there
we'll-
anyone? I wasn't able to attend the last one.
And we'll skip the shelters and solutions and coordinate entry and discharge planning, Sage.
Hi. Let's see. We are working on organizing our annual training. So that'll be coming up probably the first quarter of the year. We're also talking about so the CDC, the Community Development Commission, has coordinated entry grant funds and is doing a great job of really looking at how to best utilize those. They have staff that they've brought on board to be able to take on some of the coordinated entry role. So the committee and CDC has been talking about what does that look like. So, and what the committee has identified is the kind of priority for coordinated entry, like an admin role. The priority right now is to really get into the quality assurance side of coordinated entry, making sure that the clients are being entered properly, that they're being exited properly, that people are doing the agencies are doing follow-ups with them, that they're being moved through the coordinated entry system in the way that they're supposed to, and flagging those things and bringing it back to the committee and to the agencies that are doing the actual data entry. It's been a lot of work that the HMIS lead has been doing, and we're super grateful that the HMIS lead has been doing that work. But it's really above and beyond what is really in their scope. And so having a coordinated entry lead like the CDC will really help us improve our system. What else have we been doing? We've been talking a lot about with changes in the last couple months. Coordinated entry process.
Like we need to worry.
Katrina, thank you. So we changed our prioritization from being solely focused on COVID-19 related prioritization factors to having a broader prioritization. So with that, like, people have been the folks who are entering data into the coordinated entry system, they're still in like that learning period where they're learning how to use the new tool. So we're working on making corrections and doing follow-up trainings with folks. Yeah, that's about all I have. Thank you.
Thank you, Sage. Are there any questions for Sage? I see no questions. We're going to go to the membership committee meeting. I know we have a meeting set for December 1st at 1:30. Veronica, do you have anything to add to that?
I can't really recall who all had volunteered to attend this one-off meeting, so I'm just going to send it to all COC board and general members and advisory members. So if you want to attend, you got the information. So look out for that.
Up to a board quorum, Veronica, just.
Oh, yeah.
Board quorum -1.
Okay. So I'll invite like 8 board members.
No, you can invite them. It's just.
We can't have a whole, so RSVP. Yeah. I'll ask everybody to RSVP so I can track that. Got it.
All right. Any questions for Veronica on membership committee? Nope. All right. Brian on HMS, I really appreciated that demonstration of the dashboards. That was good information.
Sure. Because of Veterans Day last week, the HMIS and Performance Measurement Committee has been moved to this week. So at the next board meeting, we'll be reporting out on 2 months worth of meetings. Nothing to report with that committee this week as we did not meet.
All right. Thank you, Brian. So we're going to go on to ad hoc committee reports. We are done with the ad hoc funding committee for this year. We've met 3 times, I think. 3 or 4 times, I lost track. So we just need a motion to disband that, or do we need a motion, or do I just?
You just do it because the ad hocs are appointed by the co-chairs.
All right, well then we're just going to disband the ad hoc unless there's any objections to that. Hearing no objections, just consider the ad hoc for the funding committee disbanded. Anything else on that, Veronica? No. Okay, so we do need to establish a 2022 point in time count in housing inventory ad hoc committee. That is going to take place as an in-person count, as far as I'm aware, right, Veronica, in January?
Yep.
Okay. So we're going to create a point in time count ad hoc committee. Is there any volunteers to serve on it before volunteerism gets turned into requests? Brian?
With Gary kind of stepping out.
Volunteer.
So the HMIS lead is here to support all the back end. We do all the data submission to HDX. And especially if we're looking at moving over to that point in time app that we demoed a few board meetings ago, there's going to be a lot more tech support needed on the front end, but a lot less work on the back end to get accurate data.
Sage? And what we can do is we can have Veronica send out an invite to everybody and then see who. Does that work, Veronica?
I could do that.
Okay, Kate?
I was just going to say that, can I volunteer somebody? I'll just wait until I get the invite and volunteer.
Veronica will just send out an invite and then you guys can volunteer back on that email.
The best thing to do. We can argue in our agency on who wants to do it the most.
Okay, thank you. We're going to go down to funding next. Veronica, I'm just going to let you start because you have like all of them except for the last one. So let's start on emergency solution grants.
So the balance of state, the 2021 fiscal year balance of state application was submitted on time. All grant applications were submitted. And for ESGCV, I'm very close to having our next round of contracts in place. Once I get those with Ford Street, McCavan, CDC, I think that's it. And I'm working with Kate at Manzanita, but those 3 are really, really ready, almost done. And then we're going to transition to extending or amending contracts with current ESG CV providers, RCS and Hospitality Center. And then from there, we're going to look at how we want to strategize our other funding. So almost to the end of that. And that's all I have for the update on.
Thank you, Veronica. Is there any questions on the emergency solutions grant? Okay, not seeing any. We're going to go to HUD Continual Care. Veronica?
The 2021 fiscal year competition closes tomorrow at 5 p.m. Pacific Standard Time. So I've been working on our collaborative application like a mad woman. There's a lot of new information that's never been asked about regarding formal partnerships with educational entities and lots of different focuses in different areas. Equity and racial disparity and assessments is a big portion of the scoring that's never been included before. And at our last COC board meeting, the special meeting on November 10th, we approved CDC's 2 applications, one for, they're both renewal. One's a permanent supportive housing, and then the other is the coordinated entry supportive services only project. We received no applications for the COC bonus funds. So the committee approved the county throwing together a HMIS lead dedicated project to at least try to at least have a shot at trying to get that additional $90,000 for our community. So we've got those 3 applications that are being submitted, as well as the regular COC planning grant. And that's all I have for that.
Any questions for Veronica? I see no updates. There are no questions. There's no updates on cash, so we'll go over to the Homeless Housing Assistance Program for an update.
So just to give you an idea of the timeline, after the first of the year, I'd like to work back with the, after we complete the point in time count, I want to look at how the COC wants to strategically utilize the HAP funds that it's received in both rounds 1 and 2. There is a tentative budget that we have, but I really want to look at the RFQ responses that we received that we haven't been able to fund because some of those activities weren't eligible under ESG, like permanent housing stability support, case management. It's escaping me off the top of my head for the exact language, but so there was some activities that we couldn't fund with ESG that we still want to use for HAP. So I'll be looking to you guys after the first of the year to figure out how we want to move on. That's it.
And then we just applied for round 3, correct?
So round 3, it was, what we submitted was basically a statement or agreement saying we intend to apply and that we will apply, so that whenever they calculate the allotments, they know which communities to include in that. There are some communities who have opted out of HAP. And so this is kind of them getting an idea of who wants to work with who and who actually wants funding. And round 3, the county did agree to apply with the COC as for 1 application instead of 2.
Okay, Veronica. Any other questions for Veronica on the HAP? Not seeing anything. Brian, do you want to give us a update on the HUD HMIS grant building capacity?
Sure, we're still moving ahead. That grant was extended out a year. It was supposed to end in September, but we've been extended to 2022 due to COVID. We're currently, as a unit, working on developing a formal data quality and monitoring plan. So we've just started creating source documents for that to bring back to the HMIS committee and really start getting partner buy-in on what data quality looks like in our committee, what the expectations and standards are, what the carrots are, what the sticks are. You can't just put a plan in place without that buy-in from community partners and people using HMIS. We've got the go ahead to establish a data bridge between the VA home system. So it's like the veterans HMIS to lead HUD-VASH vouchers, which takes some data entry burden off of CDC. We can automate that process. And then CDC just kind of maintains and adds household members as needed. And so that's using, that grant had 36,000 set aside to create data bridges. So that's we wanted 2, we're probably only gonna get 1 data bridge with that grant, but it's still gonna be pretty good work and automate some of the HMIS data work that we can automate with that grant. Anything I'm forgetting as far as the HUD capacity building grant, Kirsty or Veronica?
I know of.
Nope, I think you covered it. Thank you, Brian.
All right, thank you, Brian. Is there any questions for Brian? Okay, not hearing questions. There's no projects. Does anybody have any announcements?
Hey, Dan,
Right.
we did skip over funding for HEAP. And I do just
Oh,
want
did
to
I?
give a
Oh, I guess I can't read today. So yeah, go ahead on HEAP, Veronica.
just really quickly, I've submitted the final report. The state has everything that they need. We're still going to have to do reporting as some of these projects that were funded, like the city of Fort Bragg's project that they're for their permanent housing. So we'll still need to do reporting over the course of the next few years, but they have everything that they need and the grant has been closed out.
Okay. Any questions on HEAP? Okay, is there any, I'll go back to any announcements. And if I don't see any announcements, the next meeting is going to be December 20th at 1:30 p.m. on Zoom.
Are we good with that? Do we want to do that meeting? I know that that's the week of a major holiday for a lot of people, so I just wanted to ask.
Why don't we ask how many of you would be attending?
What day is it again? Is it the 20th?
The 20th.
Yeah, some people start their holiday.
Yeah, I will be out that day. School districts will be.
Oh, the school districts. I won't be out. I'll be in.
I'll be here.
Would we maybe want to plan for the Monday before, since it falls on a holiday? And mine doesn't fall on a holiday specifically. I mean, it kind of does, but.
You mean
13th?
Does that squish you, Veronica, if we pulled it up a week?
There probably won't be much new information to hear. I mean, it's about a month away, but
right.
I would be able to be here on the 20th, but if we moved it to the 13th, I have a conflict at this time.
Does the world end if we say that we skip December and meet in January?
Not at this moment, Sage, but you know how COC world goes. There could be something that pops up between now and the 20th that needs to be approved. So,
right.
I guess my question is, if we're talking about the point of time count, are there things that do have to be reviewed before we get into the middle of January? Is that something this committee would be doing?
The COC.
You're forming another committee.
Yeah. The COC governance charter gives that ad hoc the authority to do everything that's necessary for the point in time count. So the governing board does not have to be involved. We purposely set it up that way after lessons learned. So I don't anticipate anything really needing to be addressed by then. The HAP grant application, I think, is due on the 13th of January.
You can always call an emergency meeting too, if you need us, especially if it's early.
Okay. That's the only thing I can think of that might come up is the HAP grant application.
It's been my experience that the state kind of goes, they may put deadlines out there, but there's nobody there either. So
do we want to plan for the 17th of January then?
So that is actually Martin Luther King Jr. Day, and we always have to move our January and February meetings to a different week.
Okay.
So could we move it up to the 10th since if we skip December?
Yeah, so the 10th, yeah, that's fine.
Yeah.
And that'll give us plenty of time if we need to provide updates for the point in time count. So Monday, January 10th.
Yep.
2022.
At 1:30.
1:30 via Zoom, unless the county does something different and opens up the room.
The last question I had is, I did receive a message from Mari today. Have you guys given Mari a deadline on when she's trying to have completed all the, okay.
No deadline.
Okay.
Okay, that is all. We will see everybody in January. If not, if we don't have a special meeting between now and January. Because I probably cursed myself with my statement.
All right. Have a good rest